my name's Taylor. I'm a nurse practitioner student, and this is the basic proficiency assessment. I've already provided hand hygiene and privacy to my patient. Now I'm going to introduce myself. My name's Taylor. I'm going to be doing an full body assessment on you. Can you tell me your name and date of birth, please?
It's Angelica Smith, and my date of birth is January 1st, 1990.
Perfect. Can you tell me where you are?
I am at a hospital.
Okay, and what are you here for?
A physical.
Okay, and do you know the date?
Today is August 24th.
Yes. Okay, the patient is alert and oriented ×4 to the person, place, time, and situation. She is calm and cooperative, and she is dressed appropriately for the weather. Upon assessment, her skin is warm and pink to the touch. No lesions or anything noted on the upper extremities or lower extremities bilaterally. Okay, I'm gonna first stand up. Okay, so can you smile for me? Puff out your cheeks and close your eyes really tight and then open them. Okay, the cranial nerve 7 is intact. Can you bite down? Okay, and open your jaw against resistance. Okay, and the cranial nerve 5 is intact. Okay. Okay, so looking here, her trachea is midline with no deviation. And then I'm going to put pressure right here. Perfect. She has good shoulder resistance. And then I want you to open your mouth. And she has good sternocleidomastoid resistance. Okay? Okay, now we're going to move on to her eyes. I'm going to test the 6 cardinal features. Okay, if you just want to follow this with your eyes and then keep looking at me straight. Good. 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 Okay. Good. Okay, and then I am going to grab a pen light and assess her pupils. I'll go in with the pen light. Good. Go here. You can just keep looking straight at me.
Whoops.
Perfect. No worries. Okay. Her pupils are equal, round, and reactive to light, and approximately 4 millimeters bilaterally. Okay. The next thing I'm going to do is assess her lungs. So upon assessment, I see that her chest expansion is symmetrical, and she doesn't have any labored breathing. I am going to lightly palpate her lungs here. Let me know if any of this is tender, okay? No masses noted on her lungs on her anterior lungs bilaterally. Next, I'm going to listen to her lung sounds in all 4 lobes. And you can just breathe normally. Okay, so there is no adventitious lung sounds on her bilateral upper and lower lobes. She is non-labored breathing with a regular rate and a regular rhythm. I'm going to now assess her posterior lungs, so you can just relax. I'm actually going to palpate first. Just let me know if any of this is tender. Feels okay?
Mm-hmm.
Okay, no masses noted bilaterally. On her posterior lungs, and I'm going to listen in all 4 lobes again. You can just breathe normally. Okay, she again has a normal rate and rhythm with no adventitious lung sounds and no labored breathing on her posterior lungs. Next, I'm going to assess her heart. I'm first going to listen to her point of maximal impulse. That's at the midclavicular line at the 5th intercostal space. Good. And then I'm going to just listen to your heart as I would normally. Okay, S1 and S2 heard. No murmurs or thrills noted. Okay. The next thing I'm going to do is move on to your peripheral. Okay, so I'm going to look here at your fingers. I don't notice any clubbing on her upper extremities bilaterally. Then we'll flip over and check her capillary refill. Okay, her capillary refill is less than 3 seconds bilaterally on her upper extremities. Good. And I note that her hair is equally distributed on her upper extremities bilaterally. And then down here, her hair is equally distributed on her lower extremities bilaterally. And then you don't take off your sock, but I would check your capillary refill down here. And it would be less than 2 seconds on both of your feet bilaterally. Okay? And then I'm going to check for edema. Looking, I don't see any edema on your upper extremities bilaterally. Same with her lower extremities bilaterally. No edema noted. I would take off her socks, but I'll leave them on for now for her. Okay, good job. And then next I'm going to assess all your pulses. So I'm going to start with your carotid. Just feel, sorry, my hands are cold. And then I will move on to her brachial, bilaterally. Good, and then I would do her radial. Good. Watch, I would remove your watch. Good, and then I would do both of her femoral pulses. Do that for you. And then I would feel her popliteal pulses behind here. And then I would feel her dorsalis pedis pulses right here. Good. Good. And then I would feel the back, which I forget what that's called. Popliteal. Okay, so all of her pulses are 2 pus bilaterally, and they're all present. And okay. Okay, next I am going to have you lay down, and we are going to look at your abdomen. Okay, just slightly. Okay. Upon assessment, it is symmetrical, it's non-descended, and it is soft. The next thing I'm going to do is listen to all of her vowel sounds in all 4 quadrants. Okay, she has active vowel sounds in all 4 quadrants, and the next thing I'm going to do is to palpate for any tenderness or masses. Let me know if any of this is tender. No? And no masses noted either. Okay, so that is for her abdomen. I'm not feeling anything. The next thing I'm going to do is assess all of her joints. Okay, so I'll have you go ahead and step back up.
Thank you.
Okay, So I'm gently going to palpate all of her joints in her upper extremities and her lower extremities, and then if anything's tender, let me know. So palpate her shoulder, nothing, no crepitus, so kind of have you move it a little bit, good. No crepitus, heat, or swelling noted in her bilateral shoulders, and then I'll check your elbow. Good. No crepitus here, swelling noted. No tenderness either. Same thing over here. Have her move a little bit. Good. No heat, swelling, or crepitus noted here. And then I'll feel your hands here. Good. Everything looks good here. No tenderness. No heat, swelling, or crepitus noted there. And then I'll have you go ahead and stand up so we can just see your hips a little bit. So you can turn towards me. Kind of, yes. Okay, perfect. Any tenderness in either? And then you can go like that. Perfect. No? Okay. No swelling, heat, crepitus noted there. And then if you want to turn your neck. Good. Good. No tenderness. Okay, no swelling, heat, or crepitus noted there. And then you can sit down, and then I'll look at your knees. Okay, so I'm just going to move your knee. Good. Palpate. All good. No tenderness. Good. And then I'll check your foot as well. You kind of move it. No crepitus. No heat, swelling, or crepitus noted, and no tenderness. Great. Do you feel okay?
Yes.
Okay. And then I'm going to next assess her range of motion and her strength in all of her joints. So I'll first start in her upper extremities. So you can stand up for this.
Okay.
And then I want you to put out your arms. And I'm going to put resistance down. I want you to just push against. Good. I'm going to put resistance up. Good. And then you can put your arms out. Good. Same thing, okay? If you can squeeze both my hands. Good. And then I'm also going to push against, so you push against my hands. Good. And then, yeah, thank you. And then, okay. So her upper extremity range of motion and strength is equal bilaterally. Okay, now we're going to do your hips. So if you just want to bring up your knee like this, and I'm going to put a little resistance, so you just push up against it, okay? Good job. And then we'll do this. Good job. Okay, so that was your hips. And then why don't you go ahead and sit down, and we'll do your legs. Sit here. Okay, if you want to push up against my hands, good. Pull back against them, good. And then push against my hands here and hold. Perfect. Okay. So her range of motion and strength is equal in her bilateral lower extremities as well, including her hips as well as her spine and her neck. Okay. The final thing I'm going to do is to test the sensitivity of your upper extremities and lower extremities. Okay, so if you just want to hold out an arm for me, and you can close your eyes if you'd like, and I just want you to tell me if this is sharp or dull sensation, okay?
Dull.
Perfect. And then I'm going to do this one. Same thing here.
Dull.
Dull?
Oh,
Or, yes?
sorry.
That's okay.
Yes.
Okay. Okay. Her sensation in her upper extremities is intact bilaterally. I'm going to do the same thing down here. Okay, lets me know if you feel sharp or dull. Okay.
Sure.
Okay. And same thing over here.
Dull.
Oh, okay.
Was that even
Awesome, yes. Okay, so her bilateral lower extremity sensation is intact. And then, I think that completes our assessments. Thank you so much for watching.